The CDC and other officials are warning people who feel symptoms of the coronavirus not to rush to the ER or urgent care, but instead to call the doctor first. Now, those warnings could be a big opportunity for telehealth companies. Contessa Brewer joins us now with more and to explain telehealth means what exactly?
It means that you can contact your doctor through an app, on your phone, FaceTime. It's all of those interfaces that would keep you out of the actual office with your doctor. And Mercer points out, Dom, that the industry has grown from $6.3 billion in 2016 to a predicted $34 billion by the end of this year. That prediction was before coronavirus. PlushCare is betting that the industry could hit $100 billion in a decade.
Coast to coast, companies that offer online, telephone, or text health services are gearing up for a barrage of calls.
Hi, how are you? Nice to see you.
PlushCare is a subscription service connecting patients to doctors at 50 top medical schools. The company says virtual visits are up 30% since December. It's ramping up for more.
People are fearful. They are worried. Should they stock up on medicines? Should they be rushing out to buy masks? And we're trying to answer those questions as best we can.
According to Mercer's annual survey, telehealth was available to nearly 90% of employees of large companies last year, though fewer than 10% were using it. Coronavirus could change that.
I've been coughing all day.
It's more than an initial consult with a physician. REALWARE offers a wearable computer to connect healthcare providers. But one distributor has sold out because of the uptick in demand amid coronavirus. And researchers can collaborate on 3D models using Athos Beam telepresence.
You can imagine how consortium could leverage our telepresence to examine the coronavirus.
The company's rushing past its pilot stage to commercial deployment for COVID-19. Still, patients have been slow to try it out.
You just don't need to see a doctor very often. The chance to use it is not very frequent, and so it doesn't spread as rapidly as some of the other technologies that are out there. Healthcare takes time. People need to build trust.
The key opportunity in telemedicine right now is bringing services to people rather than people to services, trying to prevent the spread of this dangerous infection.
I mean, it totally makes sense, right? If you're trying to prevent the spread of people around, you don't want them traveling to see their doctors. So let's say that this is one of the big catalysts behind an industry. Just how big could it become? I know that I've never used a teledoctor before. When will I start to do it, and will I count towards that massive growth ahead?
In China, the leading telemedicine company, which is called Ping a Good Doctor, said that it has seen its visits rise 9 times since coronavirus outbreak started, and its signups 10 times higher, 900% growth in its signups. Its stock is up about 50% in that time frame. Let's look at an American company, Teladoc Health, which has seen its stock go up, same thing, about 45, 48% over the last 3 months year to date. You can see it's down a little bit right now, but this is a stock that's up 115% over the last 6 months. It was already on an upward trajectory, and if coronavirus can get people to try out telemedicine once and they like it, it's much more convenient than getting in your car, scheduling an appointment, and going into
Contessa,
the doctor.
That Teladoc stock that you were just talking about, that company, because of that gain, is now worth $9 billion. You can only imagine other companies getting in.